I'm Dr. Owen Muir, and I'd like to talk about the financial rationale for rapid-acting treatments in psychiatry. We've all heard the news about remarkable treatments like Wegovy and Mounjaro, which are glucagon-like peptide-1 inhibitors that work really well for weight gain and diabetes. Unfortunately, they work so well that many people may benefit from them, and they're very expensive. It's estimated that if half of the people with obesity who are eligible for Wegovy were treated with it, it would account for 16% of all healthcare spending in America, which is currently $4.6 trillion a year in total. One of the drivers of weight gain is psychiatric illness and weight gain associated both with antidepressant medications, but prominently with antipsychotic medications often used to augment their treatment. And here, we have the opportunity to meaningfully modify the risk of weight gain and the risk of spending all of our money on effective anti-weight gain treatments if people never gain that weight in the first place. Transcranial magnetic stimulation and psychedelic medicines like psilocybin appear to be able to modify psychiatric illness fast. 5 days of treatment has been FDA approved with the SAINT protocol by Magnus Medical, thanks to research at Acacia Clinics and the Stanford Brain Stimulation Lab. Similarly, accelerated transcranial magnetic stimulation with the brain sway device in obsessive compulsive disorder has promising evidence to relieve symptoms rapidly. In these conditions, modifying the risk of needing augmentation with agents that induce weight gain turns out to be not only important for people reducing their suffering, also crucially important for reducing the long-term financial burden of having to pay for all these great new medicines that solve problems that we could have avoided with more effective rapid-acting treatment. And so when we think of the financial expense of any given psychiatric treatment, we really should be looking at its ability to get a patient to remission so they won't need to go on to treatments that can induce weight gain. Weight gain is both catastrophic metabolically, but it's also financially catastrophic, with tremendous cost of medications being borne by all of us when people become obese or get type 2 diabetes and then become candidates for these remarkably effective but remarkably expensive medications. So taking the gamble on a single dose psilocybin treatment or a rapid-acting TMS treatment may be the most effective way to save money down the line